Hi everyone, I'm Dr. Logan, physical therapist here at Elevate. Today's Doc Talk, we're going to discuss exercising with knee arthritis. What is it? Why is it beneficial to exercise? And what things we can do to mitigate those symptoms. So, what is arthritis? Usually occurs after an injury or just progressive wear and tear, where it's a loss of the articular cartilage, the tissue that goes between bones that disperses forces, decreases the friction that occurs throughout the joint. When that gets lost, the bone tries to heal itself. Well, usually there occurs bone-on-bone interaction. So therefore, that's going to stimulate increased bone growth. So you get osteophytes or pieces of bone that start to grow either at the edges of the joint space or in between the joint itself. What this can do is this can decrease the amount of range of motion that the joint has. You're going to get this feeling of stiffness. Oftentimes there's pain that gets involved with that, specifically at night too, as the progression continues. So you may experience some crepitus, some crackling, creaking, movements with movement. This is just going to make it difficult for you to accomplish your daily activities living. So we know that it's a complex multifactorial disease that unfortunately there is no cure. But it's been shown countless times through research that with exercise, you can mitigate some of these symptoms to be able to still maintain an active, healthy lifestyle while decreasing those symptoms, okay? So, what does the research show? Exercise with arthritis. Well, there is a lot of high quality evidence that shows that performing an exercise routine, immediate pain reduction after the fact. So there have been countless, and again, I just need to specify that exercise that is prescribed needs to be the appropriate intensity and frequency. Usually low impact, low loads, higher repetitions is usually what works the most, but we'll get further into that. But it has been shown that decreasing pain has been a great benefit of doing appropriate exercise activities when dealing with arthritis. It's even been shown actually 2 to 6 months after stopping an exercise program, you're still going to get pain relief. It's been shown countless times. So even just a little bit of consistent exercise, you're going to have lasting benefits from that of pain relief, as well as potentially decreasing the progression of the disease itself. So pain is number one symptom, most likely with arthritis. So one benefit of exercise is to decrease that pain. Physical function, your ability to perform your daily activities. There have been moderate quality of evidence that have shown exercise can help you continue to do the things that you want to do. Specifically, focusing on quadriceps strengthening, front of the thighs, so your mini squats, your kickouts, leg lifts, things of that nature. Really focusing on the quad muscles have been shown to really provide you with a lot of good functional, still the ability to have good function while dealing with your arthritis symptoms. Also, quality of life is another key point. Just your overall, how do you feel throughout the day? Is it a struggle to do your daily activities, to get dressed, to get in and out of the house, to go run your errands? Those things matter. And so having a high quality of life is important. And exercise with people with arthritis has been shown to have a good benefit. Things are easier, obviously, as you're less stiff, you're stronger, there's less pain involved. You'll be able to do the things that you want to and need to do throughout the day with less symptoms, less irritation, and you'll probably feel a lot happier doing those too. So things that come from the research then, again, we know that there is no cure for arthritis, but we can definitely mitigate the symptoms, and we can definitely slow down or at least reduce a little bit the progression of the arthritis symptoms with appropriate exercise. So now, what kind of exercises? Well, from all the research, there are a lot of different varieties of ways to get about someone doing the resistance training, and that's actually great news. meaning there are a lot of different ways you can get the benefits of exercise for knee arthritis. There's not specific exercises, but there are, if you're focusing on the tolerance of the exercise. Is this very painful to do this exercise? Well, then maybe you need to modify or less load or try something else to make sure that, again, it's the appropriate intensity without provoking those pain symptoms or grinding that joint to progress the disease even further. So one thing to know is that it's been shown that people that have guidance, that have either a physical therapist or a personal trainer, someone that's consistently supervising them throughout the treatment sessions, have been found to have the greatest benefits. Meaning, if you have a specific plan set up based on the day, maybe cold weather, we know that that can obviously influence arthritis. There needs to be variety and adjustments made throughout treatments at times. So having someone that has the knowledge, the skill base to appropriately modify those exercises is key with keeping things at a low intensity, but at a tolerable rate. And also being able to progress appropriately so that you're not just stagnant and plateau, right? So having someone to supervise has been shown to have greater benefits than just your general group exercise class or just a home program at home where you're just following a protocol that you see online. There's nothing wrong with those. The greatest benefits, though, is having a one-on-one interaction with a fitness or qualified professional that can help you to mitigate and go through and to supervise. Because it's always good to have someone to supervise, making sure the form is correct and to push you if it's needed, right? So muscle strength is extremely key with allowing you to have good function. Usually with arthritis, there's a significant pain and then there's an avoidance of doing anything. That's going to decrease your muscle strength, your muscle recruitment, so the amount of the muscle that's able to be recruited and fired and to be used, all of that goes down. Range of motion goes down, circulation goes down. So strength training is going to be great because it'll help maintain your overall tissue density, which can also help with preventing injuries. Also, having greater strength is going to help disperse the forces that go around the joint, right? There's multiple muscles that cross joints to provide different functions, different movements, and different planes. So having the strength equally, evenly throughout, both hamstrings, quads, calves, that's going to be vital with dispersing the amount of force that's going through the joint, and it can also mitigate point-focused excessive forces, which can further progress the OA disease. Also, focusing not just on the quad muscles, but focusing on the hips and the foot and ankle. Those are going to be important, that neuromuscular control of the knee joint, right? The knee is just a hinge. It only opens and closes. It's up to the foot and ankle, and it's up to the hip to adjust accordingly. Having that good neuromuscular control, so balance and coordination, is going to be also key to decreasing excessive stress levels throughout the knee joint and mitigating that progression of the arthritis symptoms. So usually body weight exercises, low impact exercises, so not squat jumps. Try to avoid too much planting and twisting motions. That torsion force can add to the arthritic changes. Avoiding those are going to be beneficial. So in general, to review, another thing I forgot too, just in terms of having a good cardiovascular base is going to be important. That's going to allow the muscles to have good oxygen exchange, right? Bring in the oxygen, get rid of the CO2. Oxygen intake is inversely related to mortality and morbidity, meaning if you have good oxygen exchange, if you have good cardiovascular strength, it's going to be less tiring for you to do things. Overall quality of life. So you'll be able to do more and be less fatigued from it. Another benefit of exercise for joint arthritis. So again, the joint issues, the joint symptoms, the mobility issues, quality of life, your psychological health, your mood, body composition, body fat composition, your quality of sleep, and your fatigue levels throughout the day. All of these things can be improved by having a controlled and appropriate program for your arthritic knees. So if you're looking to manage these arthritic symptoms and to maintain an active, healthy lifestyle, give us a call here at Elevate at 702-558-2151 and maintain that physical freedom. All right? Thank you so much. Have a good one. Peace out.